Let's get started. So we're going to start off in terms of key messages from the board with a patient story, but since it's my last tea break, I thought I'd bring some chocolates this morning. I'm hoping there's enough to go around. I'm afraid you at the back might need to wait. I'm afraid the people at the front are going to get the patient story. So as you remember, sometimes we have positive ones, sometimes we have ones that are not so positive. This one's a very positive one about a fairly impressive lady.
I was referred from my GP having had vague indigestion-like pain in my chest, and around March this year started coming to the Vic for various tests in the cardio unit, and then about 5 or 6 appointments later I was referred to Mr. Bowes, the cardio consultant, who recommended me for surgery. I thought the cardio unit was fabulous, and the first appointment I had there for the CT scan I thought was quite similar to what a private health clinic would look like. I've only ever been once to a private clinic, and this seemed quite similar, so I was actually quite pleased with the layout and the lounges and the way they helped you relax while you were waiting for a not very nice procedure. I can't think of any unpleasant incidents or anything that went really badly. I always thought the staff were very professional and very caring. I think the one I was most impressed with, well, apart from fabulous surgery, is it called the intensive care unit, the ICU in cardio, I thought were excellent. I was only there 24 hours, which I think is routine, but you could tell they were spot on. They worked as a team, they knew exactly what to do. They kept me well informed, they kept my relatives informed when they came in. I couldn't fault them. They were so cohesive, and they worked together so well. I just remember thinking this is a really good place to be. The approachability of the consultants, I suppose I've got this old-fashioned idea they were sort of like distant and didn't want to talk to real patients, but both Dr. Al-Najjar and Mr. Bowes were very willing to talk direct to the patient, and they both said, if you want to talk about this anymore, just get in touch and I will talk to you. And they did, and they they gave me the email addresses of their support staff, and I got a lot of help off Mr. Bowes' PA as well as Mr. Bowes. So I was a bit surprised that people are a lot more approachable and not hiding behind other staff and bureaucracy or paperwork or anything. That I could get information direct from the consultant if I needed it. The only thing that sort of went wrong, the day of my discharge, which was after 5 days, I had to wait a few hours for the medication. They were discharging me at lunchtime, 1ish, and it was a good couple of hours before they could get the meds that they were discharging me with to me, so I could actually leave. But it's, in the grand scheme of things, that's not a lot, is it? The experience for all this series of appointments and tests and then the op has been very, very, very positive. I must also say, before I forget, the food is absolutely fantastic. I don't know how they do it. They get the food out to, well, I don't know how many patients you've got, hundreds, thousands, but it's excellent. It's well prepared, and it's hot when it gets to you. And I would have stayed longer just for the catering, to be honest. I think my relatives were also, really pleased with the reception they got here, the way they were treated, the information they got from the staff. No problems with cleanliness or not. I suppose you only notice that when it's not there, don't you? But no, I think we were all very well looked after.
I've traveled the world, I've been up and down, I've seen lots of places, but this is my town. You've got what it takes, the night is awake, the music is pumping. Back to Boogaloo, where the club is kicking. Back to Boogaloo, and the tongues. Name my peekaboo, where the club is kicking. Back to Boogaloo. Gonna take to the sky. Ride a late night flight. Gotta shake on.
It's been a pleasure to look after Mrs. Limer and get this positive feedback from her. It's a fantastic advertisement for the treatment that the team gives to patients here. We're delighted to see her elaborate response. It's a team effort. The whole team are involved in patient care, and all of us are very grateful for the positive feedback that she's given us.
There you go. Fantastic story. So whether it's the clinical staff, whether it's catering, whether it's domestics, whether it's everybody involved, whether it's admin and clerical staff, a fantastic story there. I guess the only one thing being a bit of a delay on the TTH is I might mention that again a bit later on. Now, has everyone had a chocolate, by the way, because they're hogging the quality streak down here? Right, okay, so just finishing off then the messages in the middle. I'm assuming everyone can see this high quality, very thick. This must be because it's my last one. It's like sort of commemorative editions for you to keep. I can sign them. Okay, so second story down then. Slightly strange speaking about yourself in the third person, but this will be my last team brief because I should be moving on to North Wales. So as you can see, and a message has already gone out, so hopefully you're already aware of this in terms of arrangements after I finish on the 12th of Feb. So that will be Wendy acting up with Tim as deputy. There's a very, very great, I would say in fact, executive team here. They'll be taking the reins. As I'll be mentioning later on, we've done a lot of work on the strategic review, so in that regard we know what the plan is, and obviously that's the team now that are going to get on and implement that. So the board won't be rushing out to get an advert out for a chief exec, because that team will give us the continuity that I think we need. Clearly there'll be an advert go out at some point, I guess, but I think I have absolutely every confidence in Wendy. As you know, she's a very experienced lady, knows all about the Fylde Coast. And in particular Wendy and Tim really have been at the heart of putting together the strategic review. So that's what the cover arrangements will be. My leaving do will be in Polt on the 12th of Feb. If anyone would like to join me for a drink, you'd all be very welcome. Final bit of good news there, if you like, in the middle bit there in terms of the CQC. It's not actually come out yet, this, but we understand it's actually going to be released today. It's meant to be released on Friday. But we have seen the final report from the CQC. You'll recall that they came to visit us in, I think, 2014, was it? And they gave the Trust overall a rating of requires improvement. They actually gave, at that point, our maternity service a rating of inadequate. And you'll recall that at the time, I think there was a great deal of concern both from us in the Trust and from GPs and other people about whether or not that was a fair and accurate rating. They had their reasons to give that rating, but what we did get them to agree at the time was that they would come back and re-inspect. Took a while to get that re-inspection, as we said, because they're very busy. They also chose, when they came back, to look at emergency services, particularly A&E, for, I suspect, for understandable reasons, given when they came back. So they came back in September, seems a long time ago now, but the good news is that they have given maternity a revised rating, and that's a rating of good, which I think is a far more fair and balanced rating, and clearly shows a number of improvements that we've made in maternity service, but I think also shows the underlying strength of the service that was always there, to be blunt. And indeed, as is often the case, I would point out that within maternity there are some absolutely outstanding and excellent services, and like any service, there was some room to improve. But that rating of good, I think, is a far more fair a reflection. Still some things to do to improve in maternity. They also had a look at A&E. As you imagine, A&E was very busy at the time. They flagged up a number of areas where we need to improve there as well. Not all of them are just within this organisation. Obviously, in terms of A&E, it's about working with primary care, it's about working with mental health. That's one of the issues that they flagged up there. So that document will come out, and obviously it's a public document, feel free to read it, and we'll obviously be working on some actions that we can put in place to try and address some of the issues that they've highlighted. But I think that's fundamentally, as I said, a fantastic result, particularly for maternity. And my thanks to everyone that put an awful lot of effort into, people like Marie and Pat and others that put a lot of effort into planning for that, because when they arrive it is a small industry in itself. The other bit that we've not got in that middle bit, but I did raise at the board, and it seems quite timely with the news this morning, is my thanks to everybody that put another above and beyond shift in terms of the strike in January, both in terms of planning for it beforehand, but obviously on the day itself. We were able to minimise the impact on patients, which was great. I think we have good local relationships with staff side and other people. I was hoping, as I'm sure you all were, that there could be some progress nationally on that, but it does look as though we will have another strike next week, so obviously now we'll be into the planning mode for that. But thank you to everybody for the last one, and obviously my apologies, I will say again, to the patients that were affected by it. So moving to the outside of the brief, I'll go counterclockwise today, just to be different. Starting with finance, you've got the information there for the trust position up to and including December, and that was fundamentally that we were on track with the reforecast plan that we put in, which, if you recall, was for a deficit of just over £14 million. I think the challenges that we've got is that there's improvement in there, as you can see from being on the forecast, but there's a great deal of concern as we look at January and we go forward to February and March. And I think there's two major concerns in that, and one is our income in terms of some of the activity that we expected in January didn't always happen, and that's always a complex picture. There are some issues in terms of our local CCGs as well, and negotiating our contracts with them in terms of that income into the trust. The second part of the equation, as you might expect, therefore, is our cost and what it's cost us to do that work. And again, in some areas, we've got some real progress, and I'll mention some of that progress a bit later on. But there are some real challenges around that stuff. So I think the message that we're going to be getting out is that across the trust, we really need everybody focused on it. We need to delay any expenditure that we can into the next financial year, particularly those items that you might call discretionary expenditure, ranging from anything, I guess, from equipment to other things. There are a small number of areas in the trust, 2 or 3 divisions within the trust, that are really struggling to deliver their year-end forecast. So we need them to really redouble their efforts. But it's certainly, as I've said, there are some positives in there in terms of being on plan in December, but January did raise some more concerns. So February and March, I think, are going to be challenging for us to deliver that year-end forecast that we set ourselves. And obviously, if we don't deliver that year-end forecast, then what that makes is our starting position for next year worse, which, as I'm sure you're aware of, but just to reinforce that message. In terms of performance, you, I'm sure, will all know that January is one of the more, if not the very most challenging month of the year in terms of emergency services. That impact of 2 weeks over Christmas, of a new year, of services in both in healthcare and in social care, and also, of course, in the hearts and minds of the nation. That 2 weeks is different, but fundamentally what it means is that we have a period of admitting more patients than we discharge. And then what that means is that we start early January with a very, very difficult position, particularly around beds. And obviously in A&E, if you've got people waiting for beds, that means you can't even get the minor patients in and get them treated and out. So a big focus there. I guess I am, obviously, as you might expect, going to mention the lady who was dancing around the room. Probably could have gone on 3 hours earlier if we'd got that process a bit slicker. I suspect, I don't know, I haven't checked it out, I suspect that delay was actually in getting the script down to pharmacy rather than pharmacy actually turning it around. But that process of planning for discharge, even with a lady as motivated, even though she didn't perhaps want to go home because the catering was so good, but some of those delays, I think, and that patient pathway are what we've got to focus on if we're going to get A&E to be giving the service that we need it to give. A&E have done their best in terms of making patients as comfortable as they can do in there, so I'm very grateful to them for that. Second bit, just a flag up on performance, is C. diff, where looking at our numbers this year, we do keep increasingly having patients getting C. diff that we think we could have avoided. So we differentiate them. They call it lapses of care or not a lapse of care, but avoidable, unavoidable is a simpler way to look at it. Major issue within that is antibiotic use, stewardship, whatever phrase you want to use. Obviously there's lots of things you can do to minimise C. diff around cleanliness and hand hygiene and other things, but the major thing that we find when we look at every individual case, which we do, is around antibiotics really. And that obviously, I mean, we've mentioned medical staff, but in a sense it's all staff that relate to the care of a patient, making sure we're reviewing that they're under the antibiotics that they need. And now obviously you remember from some of the quite tragic stories that we've had recently, we don't want antibiotics to be delayed to be given to patients. Antibiotics need patients when they need them. If they need broad spectrum antibiotics, they need them, but then it needs to be reviewed. And there is quite a lot of evidence that that review, certainly when we look in the notes, isn't documented. So is it actually happening? I think that's the debate. So I think, you know, and as again, I think we've had a patient story before, haven't we, about what it's like to have C. diff. And if you recall, it is horrible. And the lady involved, if you remember, when she got discharged from hospital, didn't feel she got her grandkids round, clearly stomach cramps and all sorts of unpleasantness coming out of both ends. So let's try and just remind ourselves that I think there is better that we can do on that. On some really positive things at the bottom here, in terms of recruitment, I'm going to kind of lump them all together because they kind of all come under a workforce heading. I think one of the things we've really done some good work on this year is around recruitment. So whether it's reducing the time it takes us to get people into post, so that kind of pathway of a vacancy, if you like, whether it's setting up the nurse bench that we've set up and the impact that that's having, whether it's actually just getting a better handle on where we're spending agency, particularly around medical staff. Are there any alternatives? Is there a better way to cover that shift? Can we, by operating together as an NHS, operate, if you like, in a way that puts more pressure on the agency companies to reduce their rates, because they are very expensive, I would suggest. And that's worked well too. So all those things together, I think, are real positives. There's a number there for you to call, or for anyone to call, if they're interested in joining the bench. It would be great if we could get some more people on that. We need to continue with the efforts that we've put in place, keep trying to fill vacancies, which obviously is a major challenge, but I've been on some consultant appointment panels lately and appointed some really good staff. So I think there's some good things happening there. It is the major challenge in the NHS, without a shadow of a doubt, both in terms of filling vacancies, but then obviously the financial impact it has when you can. But well done to everyone on that, and keep it going. Moving to the outside bed, we're on to the outpatients development. So that's going to start very soon. It's been planned for some time. It's been supported by the Blue Skies Fund, so there's an element of charitable funds in there. I was trying to remember beforehand with Derek quite how much the kind of scheme was. Is anyone in the room who can remember the exact figure? Wendy? Pardon? 40, I was going to guess get $500,000 or so. So yeah, so around about 400,000 that hopefully will give patients and staff a better experience in outpatients. I'm sure there will be some disruption while it goes on. I'm afraid there always is. Around about 12 to 16 weeks is the programme, so hopefully we can minimise that. But that will be a good, hopefully a very positive development that we can put in place. Flu vaccination campaign, you'll know it is a hobby horse of mine, or whatever phrase you want to use. Great news that we've got over 75% of frontline staff. I'm hoping that by the end of the year that can be pushed up even more. The flu season certainly hasn't finished. 75% is great, but what that does mean is that if you take 4 staff, one of them hasn't had a flu jab in terms of our frontline staff. And then obviously if you take the trust as a whole and include all staff and go beyond frontline staff, then the figure is, I think, slightly lower as well. So even if you're not directly in contact with patients, you'll be in contact with your friends, your family, you'll be in contact with people in the canteen. So I would urge everybody still to have that flu vaccination, and please do take that message away. Strategic review is in this top right-hand corner, and we've been talking about this for quite a long time. It's been a big piece of work. It's been a piece of work where we've tried to involve as many people as possible, which is why it's taken a while, and that I think is time well spent. What we're really getting into now is that pretty much we've finished that work. It's been signed off by the board. So we're currently producing some communication materials that we can use. We're going to get some face-to-face events in the diary to kind of get that launched. A reminder of what that piece of work involved. It was, in a sense, a fairly straightforward process. It involved looking at where we are. It looked at our strengths in terms of workforce, quality, finances and operations. It looked at some of the challenges that we've got on those areas, and we've got some big challenges. It looked at what we thought would happen over the next 5 years or so if we carried on as we were, and that's everyone. We, when I say we, I mean the healthcare system, I don't mean just us. It got those people in a room and said, well, if that's not what we want, what is it that we can do that will make that picture different in 5 years' time? And from that, we then came up with some ideas, lots of ideas actually. We then grouped them, we then prioritised them. We fundamentally then came up with a number of work programmes or things to do, whatever phrase you want to use. And they are things like trying to get a higher quality, more consistent care for patients, whether that's 7 days a week, whether that's 24 hours a day, whether that's a patient with stroke or a patient with sepsis. What are we going to do to try and get them the care that they should have all the time, no matter what? It's around productivity and efficiency. It's around length of stay. It's around using the assets that we've got more effectively. It's around seeing if we can get more patients treated per theatre list. It's then around particularly working across the health economy on some key services that cross health and social care, in fact, and in particular a big focus on paediatrics and children's services, because if we get that right, by definition, that's a very good start, and that's a very much a kind of cross economy effort, and also then frail elderly patients and how we can do some different work around them. And then it's around how we can work at a more Lancashire-wide level, and what are the services that might need to change at that level, and then underpinning it all are a number of other things we need to do in terms of making all that happen, so whether it's workforce, whether it's information technology and equipment, so there's a number of enabling things under it too. I should have mentioned as well, I forgot one, in terms of getting patients into the trust and into the right place as quickly as possible, we've got this terrible phrase which is the front door, but I can't think of a better one, because when you say that to people they sort of know what you mean. But how patients will come in from usually primary care, but not always, into A&E and then go into, well at the moment they go into a surgical assessment unit, a medical assessment unit. There are potentials for other direct access to ward, but it's not very well developed. And then how that system works to get that patient to the right place as quickly as possible. And at the moment, let's be blunt, it doesn't work in many ways, and it needs to be improved, and everybody is trying to flag that up. So those are the kind of things that we're doing on the strategic review. As I said, the big step we've got to do now is really get that out and about, turn it into something that is relevant to people, something that I hope will make people think, yes, that's the right thing to do, it can be done. Other people have done it when we've done this work. We have looked at what other places around the world and around the country have done. So there's nothing in that strategic review which is science fiction or which is impossible. Equally, there's not that much in it that's easy. But I think, as I say, as we get out and you can be involved, hopefully, and your teams will be involved, as we talk to people, then the next stage is really to get everybody up to speed on it, everybody involved in it, because 6,000 hands will make light work, and if we can get the whole health economy involved, then obviously that'll be even better still. Thank you to you all for the chance of being your chief exec. It's been a challenging and difficult few years, but it's been a very good few years. I've enjoyed it. That's not a word I always use about my job. People often ask me, are you enjoying it, Gary? And I say, well, enjoy it is the word. But this is a good job. It's a good place to be. In many respects, what we do is absolutely amazing. It is difficult. It's always been that way. It always will be. There's people in this room, I think, have been at this trust for a long, long time. People have been in the NHS for a long, long time. It should never be easy, because if you like, if the NHS was able to go home and say everything's hunky-dory and we've done everything and everything's been done to plan, then we won't be doing enough, because there should always be something more that we're aspiring to do. There should always be that ambition. And let's face it, in healthcare terms, there is a never-ending demand that we've got to face. However good we get, there'll always be a need for us to get better. So in that respect, it is very tough, and I know that the next few years are going to be tough. In many respects, I am very, very sad to go. The place where I'm going has got as many challenges as this. It's slightly nearer my house than the M6, so in that regard, that's quite a pleasant thought. But you know, whether it's finances, whether it's quality, whether it's recruitment, the challenge is always there. The thing is the people that you're with, that you're trying to meet that challenge with, and there's some great people here. So thank you all. I hope you will, if you get a chance, come on my leaving do. If not, you might see me before I go. If I don't see you again, I wish you all the best and thank you all. And look forward to the next few years. I'm sure it will be challenging but good. And like I say, I've certainly enjoyed my time here, and I hope you will continue to do so. Thank you.